Stop what you are doing right now, because what I am about to share with you today could change the way your knees feel, starting as soon as tomorrow morning. I am not exaggerating. After more than 4 decades of practicing medicine, I have watched thousands of patients, good, hard-working people, suffer needlessly with knee pain, joint stiffness, and arthritis, spending thousands of dollars on medications that only mask the symptoms, while the real damage quietly continues underneath. And here is the part that breaks my heart every single time. Most of them had no idea there was a natural, powerful, science-backed drink they could make right in their own kitchen. A drink that actually feeds the joints, reduces inflammation, and helps the body rebuild what years of wear have taken away. Today, I am going to show you exactly what that drink is, what goes into it, and why every single ingredient works. If you have knee pain, joint stiffness, arthritis, or just want to protect your joints for the years ahead, this video was made for you. My name is Dr. Mandell, and for over 40 years, I have dedicated my career to helping people not just live longer, but live better with strength, mobility, and independence. See, I have seen what joint disease does to a person. I have seen active, vibrant men and women reduced to pain and dependence simply because no one ever told them the truth about what their joints actually need. Here is something most doctors never tell you during a 10-minute office visit. Your knee joint is not just a mechanical hinge. It is living tissue. It needs specific nutrients to regenerate, to stay lubricated, and to stay strong. And when those nutrients are missing from your diet, which they are for the vast majority of people over the age of 50, the cartilage slowly breaks down, inflammation sets in, and the pain becomes your constant companion. Now, I want to be very clear. I am not here to sell you anything. I am not recommending this drink as a replacement for medical treatment you may already need. What I am telling you is that this is one of the most powerfully anti-inflammatory, joint-supportive combinations of natural ingredients that nutritional science has identified. And I believe every person suffering with joint pain deserves to know about it. So let us get into it. Before we talk about the drink itself, you need to understand why your knees hurt in the first place. Because if you do not understand the problem, the solution will not make sense. Your knee joint is cushioned by a layer of cartilage, a firm, rubbery tissue that acts as a shock absorber between your bones. Healthy cartilage is smooth, resilient, and well lubricated by a fluid called synovial fluid. When you are young, your body produces enough of the building blocks to maintain that cartilage and that fluid. But here's the critical thing most people do not realize until it is too late. After the age of around 35, your body's natural production of collagen, the primary structural protein in cartilage, begins to decline. By the time you reach your 50s and 60s, that decline is significant. I had a patient, a 62-year-old retired school teacher named Margaret. She came to me barely able to walk down her own front step. She had been diagnosed with osteoarthritis in both knees years earlier. She was on anti-inflammatory medications that were affecting her stomach, and she told me she had given up hope of ever walking comfortably again. What nobody had ever talked to her about was her diet and what her joints were being starved of. Within 8 weeks of consistent changes, including this drink, she was walking her neighborhood again every morning. Not because the arthritis disappeared, but because her body finally had the fuel it needed to fight back. That story is not unique in my practice. It is actually the norm when people commit to feeding their joints properly. Now I want to walk you through this drink. what goes into it, and more importantly, why each ingredient is not just a nice addition, but a medically meaningful one. This is not a random wellness trend. Every single component of this smoothie has research behind it, and together they create something genuinely powerful. Let us go through each ingredient one by one. The foundation of this smoothie is collagen peptides. And I want you to understand what collagen is because the word gets thrown around so loosely these days that it has almost lost its meaning. Collagen is the most abundant protein in the entire human body. Supplement. It is the structural scaffolding of your joints, your tendons, your ligaments, your skin, and your bones. Type 2 collagen specifically is what makes up the cartilage in your knees. When you supplement with hydrolyzed collagen peptides, meaning the collagen has been broken down into smaller, highly absorbable chains. Your gut absorbs these peptides and they travel through your bloodstream directly to your joints. Multiple clinical studies have shown that consistent collagen supplementation can reduce joint pain, improve joint function, and actually stimulate the cells in cartilage called chondrocytes to produce more of their own collagen. I have seen the medical community be slow to embrace this, frankly, and I understand why we are trained to reach for the prescription pad. But the research on collagen and joint health has become too compelling to ignore. I recommend 1 to 2 scoops of high-quality, unflavored, hydrolyzed collagen peptides, bovine or marine, as the base of this drink every morning. Now, here is a critical mistake I see people make. They buy collagen, they take it on its own, or mix it into plain water, and they wonder why they are not seeing results. The reason is this: collagen cannot do its job without vitamin C. Vitamin C is absolutely essential for collagen synthesis in the body. It acts as a cofactor for the enzymes that help build and stabilize collagen fibers. Without it, the collagen peptides you are consuming cannot be used effectively. Which brings us to the next ingredient. For our vitamin C source in this smoothie, I recommend either fresh pineapple chunks or freshly squeezed orange juice. And pineapple brings something extra to the table that makes it my personal first choice, an enzyme called bromelain. Bromelain is one of the most remarkable naturally occurring anti-inflammatory compounds I have encountered in my career. It has been studied extensively for its ability to reduce swelling, decrease joint pain, and improve mobility in people with osteoarthritis and rheumatoid arthritis. Some studies have compared its anti-inflammatory effects favorably to NSAIDs like ibuprofen, without the gastrointestinal side effects, without the risk to your kidneys and stomach lining. Seeing this mistake destroy lives, and I mean that seriously. Long-term reliance on over-the-counter anti-inflammatory drugs for joint pain. People take ibuprofen every single day for years because their doctor told them to manage the pain and they never sought another way. And then they end up with kidney damage, stomach ulcers, their cardiovascular problems on top of their arthritis. Pineapple gives you natural anti-inflammatory power without those risks. Half a cup of fresh pineapple chunks provides ample bromelain and enough vitamin C to support your collagen synthesis beautifully. Next comes turmeric. If you are not already using this golden spice, I want you to start today. The active compound in turmeric is curcumin, and the research on curcumin and joint inflammation is extraordinary. Curcumin is one of the most studied natural compounds in medicine. It works by inhibiting several key molecules involved in the inflammatory cascade in your body, including something called NF-κB, which is essentially the master switch that turns on inflammation at the cellular level. For arthritis patients specifically, multiple randomized controlled trials have shown that curcumin supplementation can significantly reduce pain and stiffness, in some studies performing comparably to ibuprofen in managing knee osteoarthritis symptoms. This is not folk medicine. This is published, peer-reviewed science. Now, here is the key thing most people get wrong with turmeric. Curcumin has very poor bioavailability on its own. Your body absorbs only a tiny fraction of it when it is taken alone. But when you combine it with black pepper, specifically the compound in black pepper called piperine, absorption increases by up to 2,000%. So in this smoothie, we add half a teaspoon of turmeric powder and just a small pinch of black pepper. And those two together become a far more potent anti-inflammatory combination than either one alone. Add a small knob of fresh ginger as well, if you have it. Ginger contains gingerols and shogols, compounds with their own impressive anti-inflammatory and analgesic properties that complement turmeric perfectly. Now we come to one of my favorite ingredients, and one that genuinely surprises people when I bring it up in the office: tart cherry juice. Specifically, Montmorency tart cherry supplement, not the sweet cherries you find in the grocery store. Tart cherries are one of the most concentrated natural sources of anthocyanins, powerful antioxidant and anti-inflammatory compounds that have been directly studied in people with arthritis and gout. Supplement. In multiple clinical trials, tart cherry consumption was associated with significant reductions in markers of inflammation, including C-reactive protein, is one of the key markers we use in medicine to measure systemic inflammation. It also has been shown to reduce uric acid levels, which is critical for gout sufferers. Beyond that, tart cherry is a natural source of melatonin, which helps regulate sleep. And this matters for your joints more than you might think, because most of your body's tissue repair happens during deep sleep. If your sleep is disrupted, and many arthritis patients tell me their pain wakes them at night, that repair process is compromised. Tart cherry supports both inflammation reduction and sleep quality simultaneously. Use about half a cup of pure, unsweetened tart cherry juice in the smoothie. So avoid the sweetened versions. The added sugar will counteract the anti-inflammatory benefits. We add a generous handful of fresh spinach to this smoothie, and I know what you are thinking: will it taste terrible? It will not. The pineapple and cherry mask it completely. But nutritionally, spinach is bringing several critical elements to the formula. Spinach is rich in vitamin K, which plays a direct role in bone health and has been shown to help maintain the integrity of cartilage. It is also a source of magnesium, supports muscle relaxation around the joint, because a lot of the pain people experience in their knees is not just from the joint itself, but from the surrounding muscles guarding and tensing in response to that pain. Relaxing those muscles matters. For the final piece of this smoothie, I want you to add 1 tablespoon of ground flaxseed or chia seeds. These are excellent plant-based sources of omega-3 fatty acids, specifically ALA. The body partially converts to EPA and DHA, the omega-3s with the most powerful anti-inflammatory activity. Omega-3 fatty acids work directly on the inflammatory pathways in the joint lining, reducing the production of pro-inflammatory prostaglandins. This is the same mechanism that fish oil supplements are known for. Supplement, but in a natural whole food form that you can blend right into your drink. Let me walk you through the full recipe one more time so it is crystal clear. We'll take 1 to 2 scoops of hydrolyzed collagen peptides, unflavored. You will add half a cup of fresh or frozen pineapple chunks. Add half a cup of unsweetened tart cherry juice. Add 1 handful of fresh spinach. Add half a teaspoon of turmeric powder, a small pinch of black pepper, and a thumbnail-sized piece of fresh ginger if available. Add 1 tablespoon of ground flaxseed or chia seeds. Add enough water or coconut water to blend smoothly. About 1 cup. Blend everything until smooth and drink it first thing in the morning, ideally on an empty stomach or shortly after waking. Your body is in its most absorbent and receptive state in the morning. Giving your joints this nutritional support before the day's activity begins is the most effective timing. Do this consistently every single day for at least 3 to 4 weeks. So I want to be honest with you. This is not a drug. It does not work overnight. What it does is provide your body with the consistent nutritional foundation it needs to reduce inflammation, support cartilage, and improve joint lubrication over time. Patients who commit to this for 30 to 60 days report remarkable differences in stiffness, in pain levels, in their ability to walk, climb stairs, and move through their day. I want to take a moment and speak to you personally, especially if you are in your 60s, 70s, or beyond. I know what joint pain does to a life. I have watched it happen. I have had patients who used to garden every weekend who stopped because the pain was too much. Supplement, I have had grandparents who stopped getting down on the floor to play with their grandchildren because their knees could not take it. I have had men and women who were once hikers, dancers, swimmers who became sedentary not by choice, but by pain. And here is what I have learned after 40 years in this field. Your body has an extraordinary capacity to heal, but only if you give it what it needs. The tragedy is not that healing is impossible. The tragedy is that so many people simply never receive the information that would allow them to help themselves. Your independence matters. Your mobility matters. The ability to walk to your mailbox, to play with your grandkids, to travel and see the world, those things are worth fighting for. And the fight begins not in a hospital, not with a prescription, but in your own kitchen every single morning. This smoothie is not magic, but combined with appropriate medical care, staying hydrated, gentle movement and stretching, and maintaining a healthy weight, it is a powerful and meaningful contribution to the health of your joints. And unlike a pill, it has no dangerous side effects. It has only benefits. If this information has helped you, or if you think someone you love is suffering with joint pain and does not know about this, please share this video with them right now. Do not wait. Their health is worth that 30 seconds it takes to hit that share button. If you are not already subscribed to this channel, I want to ask you sincerely, please subscribe. So every week I bring you this kind of science-backed, life-changing health information that most people only discover when it is too late. Hit the subscribe button and the notification bell so you never miss a video. And leave me a comment below telling me where you feel your joint pain most. Your knees, your hips, supplement, your hands. Because I read every single comment and your response helps me know what videos to make next. Your health depends on this information. Please do not keep it to yourself. So I want to leave you with this final thought. Joint pain is not an inevitable sentence. It is not something you simply have to accept as a part of getting older. It is a signal. Your body telling you that something it needs is missing or something harmful is being allowed to continue unchecked. Today, you have been given a tool, a real, practical, scientifically grounded tool that you can use starting tomorrow morning. The question is not whether this works. The science says it does. Supplement. The question is whether you will choose to take it seriously, whether you will make the commitment to your own body, your own future, and your own freedom to move through this world with strength and without suffering. I have spent 40 years watching what happens to people who do. They age differently. They live differently. They move through their later years with a vitality that most people assume is just luck. It is not luck. It is knowledge put into action. This is Dr. Mandell. Take care of yourselves and each other. I will see you in the next video. If you care about your health, want to understand what's silently harming your body, and are ready to learn the truth about living a longer, stronger, and healthier life, subscribe to Longevity Lane with Dr. Mandell. Here, we reveal the health truths most people discover only when it's already too late.